Hi, my name is Anant Vatsayan. I'm a blood and marrow transplant attending at Children's National Hospital, Washington, D.C. I also have a special interest and expertise in treating high-risk leukemia in children, adolescents, and young adults with CAR-T therapy. So what is CAR-T therapy? CAR-T stands for chimeric antigen receptor T-cell therapy. It's an immunotherapy where patients' immune cells, called T cells, are taken from the patient's body and genetically modified in the lab and reinfused into the patients to identify and kill cancer. CAR-T therapy is truly a breakthrough therapy for high-risk leukemia, specifically B acute lymphoblastic leukemia in children, adolescents, and young adults. It is specifically effective in treating leukemia that is not responding to other therapies, or the refractory leukemia, or leukemia that has come back after treatment, which is called the relapsed leukemia. Kymriah, or tisagenlecleucel, is the first FDA-approved CAR-T therapy for children, adolescents, and young adults up to 25 years of age. There are a few things that you should know about CAR-T therapy. CAR-T therapies can be FDA approved or commercially available, like Kymriah, or they can be experimental. That means their safety and efficacy has not been proven. And to receive those therapies, patients need to be eligible and enrolled on experimental studies. Finally, these therapies can be effective when Kymriah has failed. Children's National Hospital offers both FDA-approved, commercially available CAR-T therapy Kymriah, as well as other experimental CAR-T therapies that may be effective when Kymriah has failed or there are no other better therapeutic options. There are certain side effects of CAR-T therapy. Most commonly, patients have some muscle pain, body aches, nausea, vomiting, or headache following infusion of CAR-T therapy. The most common side effect is cytokine release syndrome. Once the CAR-T is infused into the patient's body, these T cells rapidly divide and produce inflammatory molecules called cytokines, hence the term cytokine release syndrome. This can manifest as fever, and if severe, can lead to low blood pressure or low oxygen levels in the blood, because of which patients may need ICU admission. Typically, CRS, or cytokine release syndrome, starts 3 days after CAR-T infusion and lasts for about 7 days. They are treated by anti-inflammatory drugs, some fluids, oxygen. Neurotoxicity or inflammation of the brain can also happen after CAR-T therapy and usually follows cytokine release syndrome. Neurotoxicity can present as confused state. Patients can have difficulty in talking, walking, or writing, and in severe cases, it can lead to seizure. Thankfully, most of these side effects are treatable and completely reversible. However, in rare cases, severe inflammation or uncontrolled leukemia from failure of CAR-T has led to patient death shortly after CAR-T therapy. Therefore, it is very important that these side effects are promptly recognized and treated. One of the long-term side effects of CAR-T therapy, or Kymriah specifically, is the need for immunoglobulin supplementation. Immunoglobulin are infection-fighting proteins produced by normal B cells. Kymriah that targets not only abnormal B cells that cause leukemia, but also the normal B cells that produce immunoglobulins. Therefore, once the normal B cells are wiped out, patients need immunoglobulin supplementation either by a vein or under their skin. Finally, if you, your child, or a relative has a leukemia that is not responding to therapy or has come back after treatment, ask your doctor about the option of CAR-T therapies. Thank you for listening, and I wish you and your family the very best.